the fecundation in vitro laboratory. The in vitro fertilization laboratory is a key component to the success of every assisted reproduction treatment. The location, design, equipment and culture media are of vital importance to the strict requirements of gametes and embryos cultured in vitro. A highly specialized team work on it. The aim is to treat each embryo individually as a little patient, as your future child. The IVF Laboratory of the Institut Marquès is in the forefront of global reproductive biology. It is equipped with advanced technologies such as IMSI, Polaroid and Controlled Atmosphere Booth, embryoscope, application of techniques such as biopsy of the polar body, removing debris, embryo makeup, assisted hatching, freezing, vitrification of eggs and embryos. In the assisted reproduction laboratory, our biologists evaluate the different stages of embryonic development. They can be grouped into the meeting between the eggs and sperm. 1 day later, the fertilization. 2 days later, the first embryos. 3 days later, the embryo's development. When the oocytes are introduced to the sperm. The oocytes are transported to the laboratory in sterile tubes and immersed in follicular liquid. They are located using a microscope, cleaned and classified according to their state of maturity. Following this, they are kept in an incubator in culture medium at 37 degrees centigrade until insemination takes place. The quality of the oocytes is intrinsic to every woman. Oocyte fertilization may be performed using any of the following techniques. In vitro fertilization consists of introducing the oocyte to the sperm to ensure that the genetic codes merge. In order to achieve this, the oocytes and a specific concentration of sperm, 100,000 sperm with good mobility, are brought into contact in a culture medium and incubated at 37 degrees centigrade until fertilization is observed. An intracytoplasmic sperm injection, or ICSI, consists of inserting a live sperm into the cytoplasm of the oocyte. At present, this particular technique is used regularly when attempting to ensure fertilization. 1 day later, fertilization. The inseminated oocytes are incubated for between 17 and 20 hours, by which time fertilization should have taken place. Should this be the case, the oocyte would show 2 pronuclei, 1 pronucleus for the male genetic code and 1 for the female. The first cycle in the in vitro fertilization process is also diagnostic, hence allowing us to evaluate each couple's fertility rate. Analysis may reveal low fertilization rates or even total fertilization failure. 2 days later, first embryos. The fertilized oocytes then initiate the first phase of cell division. As with people, no 2 embryos are alike. Each embryo has its own characteristics, and at this stage it may be divided into 2, 3, 4 or 5 cells. Furthermore, each embryo offers a different appearance, even within the same cycle. 3 days later, embryo development. On the 3rd day, the embryo should have duplicated the number of cells present on the 2nd. Quality of the embryo. The embryo quality is determined by the number of cells, by the symmetry between them, the percentage of fragmentation, and by the presence of a single nucleus within the cells. We consider that after 48 hours of the egg's fertilization, an embryo with good features displays 4 equal-sized cells and a fragmentation percentage of below 10 to 15%. An embryo with good features at day 3 displays between 6 and 8 equal-sized cells with a low percentage of fragmentation. At Institut Marquès, we consider that each embryo is like a little patient, and we apply individualized techniques in order to help to improve possibilities of implantation and pregnancy.